If the creatinine on your blood test is higher than expected, it may be more than a warning. It can be an opportunity to protect your kidneys before more damage occurs. Maybe your doctor mentioned kidney function, EGFR, or chronic kidney disease. You nodded, took the lab report home, and then searched online until you felt more confused and anxious. You are not alone. Elevated creatinine is common in adults over 60, yet it is often misunderstood. Many patients hear a number is high but receive little practical guidance about what it means, why it happened, and what to do next. Today that changes. I'm Dr. William, your Senior Health and Wellness Consultant. In this video, I'll walk you through 5 practical, science-informed actions that may support kidney function, reduce avoidable stress on the kidneys, and improve creatinine when reversible factors are present. These are steps you can discuss and begin implementing immediately. But first, a clear statement. This video is not promising a cure and is not a substitute for medical testing, diagnosis, or treatment. Creatinine can rise for many reasons, and the correct response depends on the underlying cause, your EGFR, medications, hydration, and other conditions. If your creatinine is very high, your EGFR is very low, your urine output has decreased, or you have swelling, shortness of breath, confusion, severe weakness, chest pain, or persistent vomiting, seek immediate medical care. Serious kidney impairment often requires a nephrologist. Now let's explain what creatinine is actually telling you. Creatinine is a waste product produced continuously by your muscles. Your muscles use creatine to generate energy, and small amounts of creatinine enter the bloodstream during normal activity. Walking, lifting, climbing stairs, and ordinary muscle contractions all contribute. Under normal circumstances, the kidneys filter creatinine from the blood and remove it through urine. Because production is relatively steady, doctors use blood creatinine as one indicator of kidney filtration. Typical lab ranges are roughly 0.7 to 1.2 mg per deciliter for men and 0.5 to 1.0 mg per deciliter for women, but ranges vary by lab. Creatinine is influenced by age, sex, muscle mass, diet, hydration, medications, and activity. A muscular person may naturally have a higher creatinine than someone with low muscle mass. For this reason, clinicians don't interpret creatinine alone. They use it to calculate an estimated glomerular filtration rate, the EGFR, which estimates how effectively the kidneys filter blood. When creatinine rises and EGFR falls, it suggests the kidneys are clearing waste less efficiently. But the key question is not simply, is the number high? The real question is, why is it high? Different causes require different responses. Why creatinine may rise after age 60? Several factors often contribute, and more than one may be present simultaneously. Age-related changes. Kidney filtration capacity can decline gradually with age. The kidneys have millions of filtering units called nephrons. Over time, some lose efficiency. This doesn't mean every older adult has kidney disease, but it does mean less reserve. Dehydration, illness, certain medications, uncontrolled blood pressure, or high blood sugar can have a bigger effect. High blood pressure. Chronic hypertension is a major cause of kidney damage. Tiny blood vessels in the glomeruli filter waste and excess fluid. Long-standing high pressure can stiffen, narrow, and damage these vessels, reducing filtration. Damaged kidneys may also worsen blood pressure control, creating a vicious cycle. Diabetes and high blood sugar. Type 2. Diabetes damages small blood vessels in the glomeruli. Chronic elevated glucose promotes glycation, altering vessel walls and harming the filtering barrier. Protein may leak into the urine and filtration declines. Kidney damage can begin during prediabetes before a formal diabetes diagnosis. Dehydration. Older adults often have a less reliable thirst response. Some intentionally drink less to avoid bathroom trips. Dehydration reduces blood volume and kidney blood flow, concentrating creatinine in the blood. Sometimes rising creatinine is partly due to dehydration rather than permanent damage, but dehydration can also worsen existing disease. Medications and supplements. Some drugs alter kidney blood flow, accumulate when filtration drops, or directly stress kidney tissue. Common culprits include NSAIDs like ibuprofen and naproxen. Certain antibiotics, imaging dyes, and other prescriptions may require dose changes when kidney function is reduced. Herbal remedies and supplements are not automatically safe. Ingredients like aristolochic acid, chromium, or very high-dose vitamin C have been linked to kidney injury. Never stop prescribed medications on your own. An elevated creatinine should prompt a medication review with your doctor or pharmacist. Why early action matters. Chronic kidney disease is staged by EGFR and other markers. In earlier stages, when function is mildly or moderately reduced, there is more opportunity to address reversible causes and slow decline. By improving blood pressure, controlling blood sugar, correcting dehydration, reducing excess sodium, reviewing medications, and adjusting protein when appropriate. In later stages, lifestyle changes remain important but cannot restore lost nephron tissue. Management focuses on complications and planning for advanced treatments. An abnormal creatinine should not cause panic, but it should prompt calm, precise action. Here are 5 steps to discuss with your medical team. Action 1. Hydrate deliberately and consistently. If you are dehydrated and do not have a medical fluid restriction, improving hydration may quickly reduce stress on the kidneys. Kidneys need adequate blood flow to filter waste. Low blood volume concentrates creatinine. Because thirst is less reliable with age, drink fluids regularly rather than waiting for strong thirst. Many adults are advised about 6 to 8 glasses daily, but needs vary by body size, activity, climate, heart and kidney function, medications, and health conditions. People with heart failure, advanced kidney disease, severe swelling, low sodium, or fluid restrictions should not increase intake without guidance. Excessive water can be dangerous. Plain water is usually best. Water-rich foods like cucumber, watermelon, and soups also help. Herbal teas can interact with medications and are not appropriate for everyone. Limit sugary sodas, energy drinks, and excess alcohol. A practical strategy: keep water visible, sip regularly, use reminders, and check urine color. Pale yellow often indicates reasonable hydration. First step, review whether you drink regularly and ask your doctor if you should restrict or increase fluid. Action 2. Adjust protein intake, especially red and processed meat. Protein is essential for muscle, enzymes, and repair, but metabolizing protein produces nitrogenous waste that kidneys remove. Very high protein intake increases filtration workload. In people with reduced kidney function, excess protein may worsen hyperfiltration stress. Controlled protein reduction can slow progression in some with chronic kidney disease, but older adults risk muscle loss and malnutrition, so do not severely restrict protein without guidance. Some plans target about 0.6 to 0.8 grams per kilogram per day for selected adults not on dialysis. For a 70-kilogram person, about 42 to 56 grams daily, but needs vary. Sources matter. Red meat, processed meat, and organ meats can produce a heavier waste burden and often contain high sodium, saturated fat, and phosphorus additives. Processed meats like sausages and bacon are especially problematic. Fish, poultry, and plant-based proteins like lentils, chickpeas, tofu, and tempeh are generally preferable in appropriate portions. Eggs can be included. Egg whites provide protein with relatively less phosphorus. Plant foods may contain potassium and phosphorus, so plans must be individualized for advanced disease. The goal is not elimination but avoiding excess and choosing kidney-conscious sources. A practical start: reduce processed meats, limit large red meat portions, keep protein portions moderate, often about the size of your palm, and replace some meals with lentils, tofu, fish, or poultry. Then ask your clinician or renal dietitian, based on my eGFR and weight, how much protein should I eat daily? Action 3. Reduce salt and hidden sodium. Sodium is central to kidney and blood pressure management. High sodium intake promotes water retention, increases blood volume, raises blood pressure, and contributes to swelling. Reducing sodium can lower blood pressure and decrease kidney stress. Many processed and prepared foods contain large amounts of hidden sodium. Bread, canned soups, deli meats, frozen meals, and sauces. Reading labels, cooking more at home, choosing fresh or frozen vegetables without added salt, and using herbs and lemon for flavor can substantially cut sodium. Your doctor or dietitian can suggest personalized sodium targets based on blood pressure and kidney function. Script 21. Action 4. Review medications and supplements with a clinician. Any elevated creatinine should prompt a careful medication review. Stop or substitute drugs only under medical supervision. Common over-the-counter NSAIDs can reduce kidney blood flow and raise creatinine. Some blood pressure and heart medications interact with kidney function in ways that are manageable but require monitoring. Certain antibiotics, contrast agents, and other drugs need dose adjustments when eGFR is reduced. Discuss prescription and non-prescription medicines, herbal products, and supplements with your physician or pharmacist. They may recommend temporary discontinuation before imaging, dose changes, or safer alternatives. Action 5. Optimize blood pressure and blood sugar control. Hypertension and diabetes are leading causes of kidney damage. Small improvements in blood pressure and glucose management can slow progression. Aim for blood pressure targets set by your clinician. Many people with kidney concerns benefit from tighter control guided by a physician. If you have diabetes or prediabetes, work with your healthcare team to lower average blood glucose and prevent wide fluctuations. Lifestyle measures, regular physical activity, weight management, reduced sodium intake, and a balanced diet support both blood pressure and glucose control. Some medications that protect the kidneys, such as certain antihypertensives or newer diabetes drugs, may be appropriate. Discuss options with your doctor. A few practical additional tips. Keep a record of your creatinine, eGFR, blood pressure readings, and medications. Bring your medication list and lab results to appointments. Ask for repeat testing if your recent labs coincided with illness, dehydration, or a medication change. If you have protein in the urine, your doctor may recommend additional tests and treatments to reduce proteinuria. Consider referral to a nephrologist if eGFR is significantly reduced, proteinuria is persistent, kidney function is declining, or management becomes complex. Recap. Elevated creatinine is a signal, not a sentence. Understand what creatinine and eGFR mean and ask why the number is high. 5 practical steps to discuss with your team are: hydrate appropriately, adjust protein thoughtfully, reduce sodium and hidden salt, review medications and supplements, and optimize blood pressure and blood sugar control. These steps can reduce avoidable stress on the kidneys and create a plan tailored to your situation. If you found this helpful, share it with someone who may be worried about their kidney tests. Talk with your doctor about these steps and ask whether a referral to a renal dietitian or nephrologist is appropriate for you. Remember, act calmly, gather information, and partner with your medical team. Early informed action gives you the best chance to protect kidney health.